Providence Television International, the game changer, taking you to the outer limits of television.
Members of the Nigerian Medical Association South-South Zone have renewed the call to intensify public-private partnership in the Nigerian health sector as a means to boost healthcare delivery in the country. The call was made during the Professor Dominic Osaghae Leadership Lecture and Award Ceremony organized by the NMA, which took place in Benin City. The lecture, titled Public-Private Partnership, Creating Better Medical Practice Environments in South-South Nigeria, and presented by consultant community medicine and public health physician Dr. Budeno Ehis, highlighted the challenges the medical practitioners presently face in their quest to provide optimum healthcare delivery. Dr. Budeno emphasized that poor healthcare infrastructure, inadequate funding of government hospitals, brain drain, which has resulted in shortage of healthcare professionals, environmental health problems, and rural healthcare inequality are the major challenges presently affecting modern healthcare delivery in the South-South. He further stated that public-private partnership will help improve access to quality healthcare services, modernize healthcare infrastructure, encourage innovation and technology adoption, and enhance workforce capacity and service delivery.
We all know the challenges in our hospitals, from epileptic light supply to stock out essential medications, and equipment seats idle for waiting to be repaired, and frustrations of knowing what patients need but being unable to provide it. The question is not whether our teaching hospitals and specialists are struggling or in comatose. Yes, they are. The question is whether we can build a sustainable ethical partnership with private sector actors to change reality without compromising patient care.
Some medical practitioners who were present at the ceremony also expressed their views on the gains of improved public-private partnership in the healthcare sector.
Well, discussion about PPP in Medicare has been on for several decades, and that indeed is the way to go. Government can certainly not do it alone. The World Health Organization aptly defined health as not just merely the absence of disease, but a state of complete physical, mental, and psychological well-being. And for you to achieve that, you need to ensure that the necessary infrastructure, the equipment, and all of that is present. People are talking about telemedicine now, people are talking about robotic and all of that in healthcare. It is difficult with the continued expansion and the establishment of new medical centers by the federal government and state and local governments. It is essential that we bring in private funds into the health sector. That way, you have cutting-edge facilities and equipment to ensure that the health sector truly works. And that, for me, is what will bring happiness and prosperity to a country. Because any nation that wishes to advance must invest heavily in healthcare and then education. But for me, talking about healthcare, investing heavily in it, not just by government, but by the private sector, is what will bring about the much needed development of a country. Public-private partnership, PPP, has a very bright future in Nigeria and the setting of today. We know that anywhere the private sector comes in, it brings excellence with it. It brings a lot of forward-thinking ideas with it, and when you combine it with what's happening in the public sector, you tend to have forward-thinking policies that at the end of the day will bring a lot of light to healthcare. We know that currently in Nigeria, you have approximately about 4 doctors to about 1 to 10,000 persons, and as a result of that, there's a lot of deficits that needs to be covered, and this is where public-private partnership actually comes in, because it's something that we need to sit back and ask ourselves, how can we get the best out of this partnership? Because even when you look out there, big businesses that built based on partnerships, and the private sector is what drives economic growth in any country. So I think it is something that we should, look forward to, and we should project in the setting of today.
A cross-section of medical practitioners also present at the ceremony extolled Professor Dominic Osaghae's impeccable character, in whose honor the lecture was organized. They applauded his immense dedication to the well-being of members of the NMA, stressing that Professor Osaghae's leadership qualities led to the peaceful atmosphere the organization presently enjoys.
Professor Dominic Osaghae is effectively the leader of the medical community in Edo State. I'm sure you agree with me. He built the structure upon which the medical association today is resting. So, sir, you deserve all the honors. It was in your time that we designed NMA, and since that constitution that was passed in Benin, NMA has remained one indivisible entity.
Professor Osaghae is a man of many parts and many phases. He's an enigma, he's a go-getter, he's an astute physician who has spent more than 3 decades or 4 decades of his life piloting the affairs of the medical practice. And as a neonatologist, a pediatrician rather, he has done so much in the medical space, not only in the private sector, of which his facility is renowned all over the south, even the whole country. So also he has made a mark in the public space, vis-a-vis his work at Central Hospital before he left for the private practice. And in the academic field, he has played a major role in grooming younger doctors with his role in the Benin University. And there's not enough words to describe the impact he has made, even in the medical field, the academic world, and in the private practice, as well as in his philanthropic life. He has touched the life of many, even those who have met him in one point or the other. So Professor Osaghae is a man of many parts.
Professor Dominic Osaghae is an astute pediatrician. He is our father, he is our teacher. He is our leader in the medical sector. He has been national president of the Nigeria Association of Resident Doctors. He has been past president of the Nigeria Medical Association. He has even been past chairman of the Edo State branch of the Nigeria Medical Association. He is a leader in every sense who has spent majority of his adult life advocating for doctors, good health delivery, as well as safety for all members of the association.
Professor Osaghae's amiable wife, Mrs. Gertrude Osaghae, while recalling the challenges her husband faced in his quest to reform the NMA, noted that the lecture organized in his honor was one well deserved.
It's a great achievement for him, and it was not an easy road. In the thick and thin of it all, I think the key thing is endurance, patience, and humility that brought him thus far. In the days of the struggle, I remember sleepless nights, using his personal money to do so many things. He never waited for NMA finances to get anything done. He will always tell you somebody has to stand in the gap, and that's exactly what he did. I'm particularly happy that all that present-day doctors are enjoying It was all his struggle and effort. And I thank God that in his lifetime he is honored by his association, you know. And it is one of my own heart cry too, that he will be honored by the association, because he really fought tooth and nail to get the association to where it is today.
In his remarks, Professor Dominic Osaghae expressed gratitude to the South-South Caucus of the NMA for the honor bestowed on him by organizing the lecture in his honor.
I stand before you today with profound humility, deep gratitude, and overwhelming sense of honor to have this leadership lecture named after me during my own lifetime. It is a privilege beyond anything I could have imagined. I sincerely thank the South-South Caucus of the NMA for considering me worthy of this exceptional recognition. I accept this honor not as a personal achievement alone, but as a tribute to the many remarkable colleagues with whom I've had the privilege of serving over several decades. Ladies and gentlemen, leadership, especially in a professional association such as ours, is never the accomplishment of an individual. It is a collective enterprise built on trust, sacrifice, shared vision, and willingness of many to place institutional interests above personal ambitions. In this regard, in my journey in the association, I want to put on record on this occasion that this honor, though I'm here receiving it, but I receive it on behalf of all those that joined in the struggle to reposition NMA in the late 1990s to the early and mid-2000s. In particular, I want to recognize the officers that served with me, including Dr. Dangana of late memory, Dr. Enyida of River State. Dangana was from Jos. Then Dr. Chief Adiliye from Lagos, Katibi from Ilorin, then Dr. Alapa of blessed memory, and Dr. Osaghae Enabulele. I will also pay tribute to all those in the NMA, those states, when the struggle started. In 1998, or thereabout, when NMA National was snowballing into crisis of national dimension, Dr. Imoga was chairman NMA Edo State at the time. He's here, and I confirm all he said. There were others who played key roles in Edo State, particularly when I first resigned my position as first Vice President NMA National under President Okpadu, when the association was immersed in deep consumer crisis. I had to resign my position in order that I will be better positioned to lead the vanguard against the constitutional imbroglio at the time. I thank you all. Today's lecture is to your tribute, actually. Many more are not here today, and I cannot list every person here, but they are recognized. I still recall that I had to write down this thing in a book, what I call The Story of the Crisis of NMA. It's there. I brought some copies here. And also the story of NMA Edo State. And like my CV said, I spent over 60% of my adult life fighting in the NMA, NROD and NMA. So anytime I talk about the NMA, unless you force me, I don't stop. I'm so passionate about it.
High point of the ceremony was a presentation of an award of excellence to Professor Dominic Osaghae for his efforts in advancing the well-being of the members of the South-South zone of the NMA.
Our Prof, our leader, we are very proud of your accomplishments. This is just a token of appreciation for your many decades of service to the medical profession. So on behalf of the South-South zone of the Nigerian Medical Association, I present this token to you, in recognition of your many decades of astounding service to the medical profession, to our state, and to our country. God bless you, sir.
Other awardees are the present National President of the NMA, Professor Ernest Afekide Omoti, and Dr. Bodeno Ehis. Ugbebo Ikekwa, Providence Television International News.